Hey guys, in this video, I'm going to talk to you about what you can do for your gas. Oh yes, I am excited about this topic. A lot of people ask me about, they have a lot of gas, they belch, they have gas down below. And in this video, we'll talk about what you can do, what are the causes, and what are my recommendations to help out with your gas issues. So if you're having gas, watch this video. Let's begin. Thank you guys for joining me today. My name is Dr. Samir Islam. If you're joining me for this video for the first time, I'm a board certified poop doctor. Yes, there's an actual job that somebody has, and my passion is to give you tips and tricks to help out with your health. If you're new to these video series, I do a series of videos every week on your gut health, your overall health, and some product reviews and educational videos like this video today. At any point in time, click on the show notes down below where I give some of the information about what I talk about in these videos. But in today's video, let's talk about what we can do about gas. We'll learn about how much is too much gas, what is normal, what is not normal, what are the causes of gas, what are the symptoms of increased gas, and most importantly, what I'm going to recommend to help fix your gas. So when it comes to gas and farting and bloating, we have to kind of understand what is normal and what is not normal. So amazingly enough, there actually are studies about what is the normal amount of gas that people produce. It's weird. I don't know why people study this, but some people do. We know that the normal amount of gas people have can range from about 14 to about 20 times per day. Now, that may be a lot of gas for people, but that is considered normal. And it really just depends on what you eat. A lot of the foods that we have can produce a lot of gas. So if you're hoping that you can be gas-free completely in your day, I'm sorry, but that is not going to happen. You're going to have gas, but the normal range, going to what we think of normal, is around 14 to 20, maybe in the mid-20s or so. Some people can be higher, some people can be lower. That is what we consider a normal gas pattern. Now, when it comes to gas, there are two main causes of why people have a lot of gas. And the first one is actually not a very known problem, but a lot of people have, is that they can swallow too much air. Obviously, the second cause can be just certain foods and drinks that people have. I think a lot of people know about that. But let's talk about the first one, swallowing air. Now, a lot of people don't realize they actually swallow a ton of air. And this is more than just eating your normal food whenever you eat and swallowing air from that, or breathing. But people swallow air if you smoke too much. So if you're smoking a lot, you're actually ingesting a lot more air than people who don't smoke. If you chew a lot of gum, that act of gum chewing actually forces air to go down into your stomach and produce a lot of gas as well. And obviously, carbonated drinks. People don't put one and one together and understand that carbonated drinks, that carbonation can produce a lot of gas as well. And so these are the more common reasons why people swallow a lot of air. And by swallowing a lot of air, you're going to produce a lot of gas. But also, anxiety can produce a lot of air as well. When you're anxious, you're breathing a lot more. Your heart rate goes up. You increase the amount of air that you swallow. And people who are anxious, or you're in a situation in which you have a lot of anxiety, that is going to cause you to swallow a lot of air as well. And so these are very simple things that you can do to minimize that. Avoid carbonated drinks, maybe minimize the amount of gum that you chew, obviously stop smoking, and also if you have some anxiety, see if you can get help with that. Now, the most common cause why people have gas is just food and drinks. And there are a lot of foods that can cause gas to occur. One of the more common ones actually are cauliflower and broccoli. People don't realize that the fiber in cauliflower and broccoli can produce a lot of gas. I have a lot of people tell me, hey, Dr. Islam, I'm having a lot of gas. What do I do about that? And one of the first things I ask is, watch your diet. And if you have a diet that's high in cauliflower or broccoli, you in particular may be having a lot of gas issues. The second common reason for certain foods is carbohydrates. Carbohydrates for a lot of people can produce a lot of gas. They may be sensitive to certain wheat products, maybe they're sensitive to certain sugars, maybe breads make them have a lot of gas as well. And so carbohydrates is a very common reason why people have gas. And this is why people who go on a more of a low carbohydrate diet, maybe even a diet called the FODMAP diet, can actually improve their gas and gut symptoms by minimizing the amount of carbohydrates that they actually ingest. Now, other reasons for gas include things like lentils and beans. Okay, duh, I think you guys have heard that limerick about the beans. And so beans actually do make people fart a lot more. And so, you know, if you have a lot of beans, whether you have Tex-Mex like me, or you have foods like lentils, that's going to produce a lot of gas. Dairy products cause a lot of gas, and a lot of people don't realize that a lot of their gut symptoms, bloating, distension, farting, gas, is due to dairy products. So if you have gas, if you have ice cream, milk, cheese, you actually may be lactose intolerant, and try to take a lactose-free product, or maybe even try to take a lactate pill as well. I'll put a link down below about my recommendations for that. Fruits can cause gas for a lot of people. Apples can cause gas, and that they don't realize that people actually may be sensitive to certain fruits, including apples, that are known to produce gas. Whole grains, like I mentioned before, carbonated drinks, like I mentioned before, and sugar-free gums and candies actually produce a lot of gas. In the sugar-free gums, there are certain artificial sweeteners in those gums that a lot of people are sensitive to and cause an allergy to as well. And so if you chew a lot of gum, in addition to swallowing an amount of air, the actual gum itself may actually have products in it that can make it more sensitive to you to produce a lot of gas. Now, when you have gas, this can be due to any number of different symptoms or causes. One of them includes a condition called IBS, or irritable bowel syndrome, in which your gut reacts to certain foods or environment or stress to produce gas, bloating, pain, diarrhea, and constipation. Gas may be a symptom of acid reflux as well. If you have a lot of regurgitation, if you have burning, if you have symptoms of reflux, in addition to gas, try to treat your acid reflux more effectively to help out with your gas issues. Like I mentioned before, if you have lactose intolerance, actually may be a sign for that. You may need to be on a certain medication to help out with that, which I'll put a link down below. You may be malabsorbing certain ingredients. Maybe it's certain carbohydrates, wheat, gluten, things like that. You actually may have a condition called celiac disease, this is an actual autoimmune disease in which your body attacks itself to get rid of the particular product that's there. And I have a link down below. I'll put a link also about what celiac disease is. Or maybe you may have just a gastroenteritis or a stomach illness, which can produce gas as well. So now that we talked about gas, let's get to the meat of the problem, which is how to fix your gas and my recommendations to help out with your gas. If you're suffering from gas, this is the part where I want you to really listen to. So there are medications actually that are out there that can fix gas, things like simethicone. Simethicone is an over-the-counter medication. You may actually find the actual medication called simethicone. It may be in the ingredients, but things like Gas X have simethicone in there, and this can help out with gas. It's a very effective option if you have a lot of bloating, a lot of gas, a lot of distension. I'll put a link in the show notes about my recommendations for over-the-counter treatment for gas. But if you're looking for a treatment for gas, find something that has an ingredient called simethicone. It's a gas buster that actually helps to get rid of gas. The second thing I would recommend is if you smoke, stop. Smoking sucks. Don't do it. It is terrible for you. There's no benefit from that. If you need help with stopping to smoke, speak to your healthcare provider about what you can do to help minimize your chances of developing problems from smoking. Limit your carbohydrate consumption. If you notice that your gas gets worse by certain foods or you don't know what foods to avoid, the first thing I recommend for my patients, eliminate or minimize carbohydrates. See how you feel with that. I have a lot of people who have got symptoms who, by just minimizing their carbohydrates or even eliminate that, they feel so much better. Try doing that for a week, see how you feel. Chew your foods very, very carefully. Don't be a fast eater. Don't just chomp and eat and eat and eat and eat and get done and try to move on to the next thing. Sit down, relax, chew your food carefully, take your time. You actually may be swallowing a lot more air than what you realize. Drink plenty of water. Drinking water will help out with gas. If you're having a lot of gas, drink some water. Not only will make you feel fuller quicker, it actually will force you to eat a lot slower as well. Don't use straws. Straws are a very common reason why people have gas, and we use straws a lot. That sucking in of air from the straw will actually have you swallow more air. And so if you're using a straw, try to minimize that or even eliminate that as well. And like I mentioned before, avoiding carbonated drinks. If you have drinks like sodas, sparkling water, anything with carbonation, I can tell you, you're going to get gas from that. You want to try to minimize that, to hopefully minimize the gas that may be occurring inside your GI tract. And then lastly, exercise daily. Make sure you do get your normal exercise. Exercise is very important for you, not only for your gut health, but also for your mental health. It helps to move things around. If you're constipated, it can help you have better bowel movements. If you're bloated or gassy, it can help kind of stimulate the process of moving things from your stomach down to your colon so you can get rid of any residual issues that are there. And then lastly, start a food and drink journal. If you don't know exactly what to do, you tried my other tips, try a journal. Journal exactly what you're eating, journal exactly your response to that, and find out if there's a correlation between what you eat and whether your symptoms are related to that or not. So in summary, gas is a problem, but don't worry, everyone has gas. I'm sorry, if you want to try to eliminate gas completely, that is not going to happen. That is a function of you just being a human being. And so we all pass gas, I'm sorry, we all do. But the most common reason why people have gas is really lifestyle, the things that we eat, the drinks that we have, the way we eat. These are very common causes of why people may have gas. If you're having consistent problems with gas, make sure you speak to your healthcare provider. There may be other things going on, whether there's an infection inside your gut, whether it's a sign of some other condition. Make sure you speak to your healthcare provider. So my question for you guys, my question of the day, what solutions do you have about your gas? What have you done to help out with gas? What tips and tricks do you recommend for our community to help out with your gas? Comment down below. I would love to hear what you guys have done or tried to help out with some of your gas issues. Well, thank you guys for joining me today. Every Tuesday around 6:30 a.m. I do my Facebook Live where I try to give you a tip or trick for your health. If you have a topic you want me to speak about, comment down below. I'd love to hear what you guys have to say. I'll make sure to give you guys a shout out. And every Thursday around 7:30 a.m. I do a Poop Tip Thursday where I drop one poop bomb for your health to help out for the rest of the week. Thank you guys for joining me today. I would love to see what you guys have to say. Join me on social media. Follow me on Facebook, Instagram, and YouTube. And I hope you guys have a great and less gassy day. Thanks and take care. Boom. Let's talk about gas, pooping, farting. Wait, is that exactly what I want to talk about? I don't know. All right, guys, let us see what we can do to help you fart better. I don't know. Farting? Can I say that? I don't know. Gas, gas, gas. Everybody's nemesis. Everybody hates it. Man, it sucks when you're gassy. That sucks. That is terrible. Ugh.